Hey there, welcome back to MEDx Show. I'm Kavi Yadav, an NHPC registered general medicine assistant and a full scholarship awardee in hospital and healthcare management at Pokhara University. On this channel, I share real and practical strategies to help you grow your healthcare business, either at clinic or hospitals in a modern healthcare. So today our topic is telemedicine. So the question is how you can use telemedicine to scale your healthcare services in 2025. Just like one rural hospital in India already did. So we will look at their story and then walk through 5 simple steps that you can also use to scale your healthcare services and your patients can achieve the maximum satisfaction from your services in 2025. So grab your notebook and let's dive into the video. Let me tell you about Eragonda. Eragonda is one small village in Andhra Pradesh, India. So back in 2001, the people of Eragonda they faced a lots of problem including healthcare because there is no access to doctors. Even for the basic checkup, they had to travel 8 kilometers. And for the families who do not have transportation services, that means there is no care at all for them. But then came something amazing. Apollo Rural Hospital teamed up with Apollo Hospital in Chennai using telemedicine satellite links from ISRO. So that was very simple. They followed very simple strategy. Patients who came into the local clinic, they just sat in their local clinic and a doctor miles away, they spoke to their patients live and checked the ECG of their patients and gave them a real advice. By 2005, over 25,000 patients had used it and they became able to save their money, their time, as well as they improve their health too. So now you can see the result of the Apollo Hospital. Today, Apollo's network reaches across the India just by going digital. In the beginning, they had just started from one small rural hospital, right? So the simple idea is you just have to connect the people to the care no matter where they live. So the question is how do you start? Now we go through 5 simple steps that you can also use it to scale your healthcare business in 2025. So the first thing is know what people need. You don't need to rush and waste your money in buying, apps or devices. You just have to figure out what another people is struggling with and which healthcare service it's missing. So let me clear you about this with the example of Eragonda. In Eragonda, before starting telemedicine, people usually wanted the help for chronic diseases because the chronic diseases cases were very high, like blood pressures and diabetes. So when the Apollo Hospital found that the high demand is help for chronic diseases, so that's where they started. Similarly, what can you do? You can also identify the demand of the people, the demand of the patients, right? So what can you do? You can talk to your staffs and you can ask to the people in the community for various healthcare services. For example, do they need, maternal care, nutritional guidance, follow-ups after surgery? There are so many healthcare services that may be missing in your community. So you have to do one thing. You just have to ask with the people and identify the actual demand. And start from where the need is biggest, and you will see the real result faster. Now, let's talk about technology. You don't need anything fancy. You just have to choose easy, simple, and cheap technology. For example, there are so many free apps that you can use for your telemedicine services. Like Zoom works great, and there are so many social media platforms, social media apps like Facebook, Insta, WhatsApp. There are almost all the peoples in India as well as Nepal and many Asian countries, they use these platforms, these apps, right? So you can start your telemedicine services from here. But if you are from India, then try eSanjeevani. It is totally free platform started in 2020 by Indian government and it works well in rural clinic. But just remember, your patient is not tech savvy. So always choose that technology what your patients, your target groups already know about that, right? Sometimes one good phone call is far better than a fancy app that no one can understand. So you have to remember this. Any technology doesn't work without people. Maybe due to advancement of technology, the size of the number of people will decrease. But there always be need of the people to operate the technology, to run the technology, right? That's why your nurses, assistants, as well as doctors, they must need to be comfortable while doing video calls, checking medical records, as well as explaining it to the patients. I will give you the real example how Apollo Hospital trained their staff before starting the telemedicine services. At Apollo, they trained their staff just within 2 days how to use the ECG machines connected to the computer and how to start the telemedicine consultations. So what can you do? Here is the easy steps for you. You can organize the workshop and let your staff practice the mock calls. If your hospital or clinic that is specialized, then you have the specified or particular patient groups. But if you have general clinics or general hospital, then your patient groups are different, right? Because there may be pediatrics group, male, female, gynae patients, obstetrics patient, as well as all the geriatric patient. So your patient group will be different. So that's why make sure your staffs know how to talk with different patient group on phone. For example, they have to know well how to talk with old age people like grandmother on phone. We had never used the video before, right? So why it's important? You may think like why it's important. It is very important because if your staff feel confident, then 100% your patient too. You have to remember this. So organize the workshop and train your staff. You don't have to pay for everything yourself. There are so many NGOs, CSR programs, health missions. You can just do partnership with them. Let me make it clear about this with the real example. How Apollo Hospital started telemedicine with partnership. Apollo got free satellite help from ISRO. How? Just by doing the agreement that they will treat the patients at the government rate. So for a smart partnership, you have to look around. There is funding out here. You just have to ask and apply for it. You can have the best system, but if no one knows about it, that means it is worthless. So tell about your services to the people with the use of various social media platforms. What can you do? Make a simple post on WhatsApp, Facebook, Instagram, as well as TikTok. So for this, you just have to record 20-second video of our happy patients saying that now I don't have to travel long for checkups. I can easily get qualified medical consultation in my own room, in my own home, right? So in this way, you can post your video into a local groups. So from where the people can know about your services, what services you are going to deliver, right? But remember that you don't need the high production. You just need to be real, clear, and local. So that's it. Now we are going to recall those 5 strategies that can help you to scale your healthcare business with the use of telemedicine in 2025. First one is you have to know what people need. Second, use the easy, simple, and cheap technology. Third, train your staff. Fourth one is do partnership smartly. Fifth, and the last one is tell about your services to the people. So that's it. Now I want to hear from you. What is your biggest telemedicine challenges right now? So drop it into the comment sections. I will give you the personal tips to get it started. If you found this video useful, then do like and don't forget to subscribe to get more weekly strategies to grow your healthcare business, either it's clinics or hospital. So let's make healthcare accessible for everyone.